everyone, and thank you for watching my presentation on the World Health Organization, or the WHO. The WHO is headquartered in Geneva, Switzerland. With their mission, it is for the attainment by all peoples of the highest possible level of health. And they base the definition of health in their constitution, which is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The WHO also proposes conventions, agreements, regulations, and makes recommendations about international nomenclature of diseases, causes of death, and public health practices. It assists with developing and establishing and promoting international standards where food and biological, pharmaceutical, and other similar substances. So, for instance, with the creation of new vaccines for Ebola or typhoid, or tuberculosis, as I'll talk about later in the presentation. When looking at the history of the WHO, in 1945, with the creation of the United Nations, one of the things that was discussed was the need for a global health organization. This came about on April 7th, 1948, so about 3 years later. And the WHO was founded on the principle that health is a human right and all people should enjoy the highest standard of health. In their work, there are 194 member states, and that is designated in two different types of categories. They have many offices in about 150 countries, but there are 6 regional offices around the world. The regional office for Africa, the regional office for the Americas, the regional office for Southeast Asia, the regional office for Europe, the regional office for the Eastern Mediterranean, and last, the regional office for the Western Pacific. So like I had said before, the WHO offices in 150 counties, territories, and areas. They have the 6 regional offices, and then the headquarters, which is in Geneva, Switzerland. Over 7,000 people from 150 countries, from those 150 countries that the WHO offices in, work for the WHO. In addition to your standard medical doctors, public health specialists, scientists, and epidemiologists, WHO staff also includes people trained to manage the administrative, the financial, and information systems, as well as experts in the field of health statistics, economics, and emergency relief. As we all know, doctors always need help with administrative things. So in looking at the WHO funding, there are 2 primary sources of revenue. One is assessed contributions, which is set amounts to be paid by member state governments. And the member state governments' amounts are based on income and population of the member state. The second source of revenue are voluntary contributions. Now, this can include additional funds from member states, which is in addition to their assessed contribution amount. And it can also include contributions from private organizations and individuals. Now, assessed contributions are considered core funding, which means that they are flexible funds that can be used to cover general expenses and program activities. Much like in your normal NGOs, voluntary contributions, on the other hand, are often specified, which means that they're earmarked by the donor for certain activities. So as an example, if I only wanted to donate to children's health initiatives in Africa, I could earmark my donation to only be used for children's health activities in Africa. Several years ago, the majority of the WHO's revenue came from assessed contributions, but over time, voluntary contributions have come to comprise the greater share of the WHO's budget. This has occurred generally because as government administration's priorities have shifted, their budgets have shifted as well. In the little chart I have here to the side, it shows the 2016 to 2017, how the assessed contributions totaled 927 million, which averaged out to about 18% of the total revenue, while voluntary contributions totaled 4.116 billion, or 80% of the revenue. And then other revenue, which could have been anything really, they didn't specify, only came to 96 million, so less than 2%. So that's essentially how the WHO receives funding. Now, the functions of the WHO have a wide variety, as is listed in their constitution. They are to act as the directing and coordinating authority on international health work, and this is in conjunction with the United Nations, to promote technical cooperation, that is, to provide the medical expertise, to assist governments upon request in strengthening health services, to furnish technical assistance and emergency aid upon the request and acceptance of government. So, as in the case of the Ebola crisis in West Africa and in the Congo, they furnished the aid once the government requested and accepted their offer. To stimulate and advance work on the prevention and control of epidemic, endemic, and other diseases. To promote, in cooperation with other specialized agencies where necessary, the improvement of nutrition, housing, sanitation, recreation, economic, or working conditions and other aspects of environmental hygiene. This is also one of the functions that they are really stressing right now, as understanding has grown that environmental hygiene has been responsible for quite a few disease outbreaks in different parts of the world. To promote and coordinate biomedical and health services research, to promote improved standards of teaching and training in the health, medical, and related professions. So in essence, to make sure that people are educated in the countries where they're working so that they can then do the work themselves. To establish and stimulate the establishment of international standards for biological, pharmaceutical, and similar products, and to standardize diagnostic procedures. This was also very pertinent during the Ebola crisis. And last but not least, to foster activities in the field of mental health, especially those activities affecting the harmony of human relations. And that was actually very interesting to me due to the fact that we are seeing an increased amount of individuals suffering from mental issues, I hesitate to use that word, around the world, such as depression or bipolar, and it is becoming a greater issue in the world. So the fact that the WHO is aware of that is a very promising thing. So the WHO has a 6-point agenda that was created in response to the challenge of the international community growing and changing, and how public health boundaries have become very blurry. So they created this approach where, with health objectives, it is to promote development and foster health security. The strategic needs are strengthening health systems and harnessing research, information, and evidence. And then the operational approach is enhancing partnerships and improving performance. And I apologize for my cell phone just now going off. So the governance of the WHO takes place through the World Health Assembly, the decision-making, which is the decision-making body, and the executive board, which affects the decisions and policies of the Health Assembly. The organization is headed by the Director General, who is appointed by the Health Assembly on the nomination of the Executive Board. So the Executive Board is comprised of 34 technically qualified members. To be perfectly honest, everyone on that board has the title doctor. So medical professionals who are elected for 3-year terms. The annual board meeting, which is in January every year, is when members agree upon the agenda for the World Health Assembly and resolutions for the Health Assembly to consider. The World Health Assembly, which meets annually in Geneva, Switzerland at the headquarters, is attended by delegates from all of the member states and focuses on the specific health agenda which was prepared by the Executive Board. The main functions of the Assembly are to determine the policies of the WHO, appoint the Director General, supervise financial policies, and review and approve the proposed program budgets. So the current Director General is, and forgive me, I am going to butcher this, Dr. Tedros Adhanom, and I have no clue how to say his last name. I'm not even going to try. He was born in Asmara, Eritrea, which is a country in the Horn of Africa. Now, he is a very recent elected Director General. He was elected in May 2017. And what's interesting is he is the first WHO Director General to have been elected from multiple candidates by the World Health Assembly, and is the first person from the WHO African region to serve as the Director General. So immediately after taking office, Dr. Tedros outlined his 5 key priorities for the organization, and in a little bit I'll go into his vision for the organization, which is rather different from previous Director Generals. His first priority is universal health coverage, health emergencies, women's, children's, and adolescents' health, the health impacts of climate and environmental change. This is a big one right now, especially with all of the divisiveness and polarization that is occurring because of any climate or environmental changes or things that are being proposed. The fact that the WHO is looking at the health impact is pretty big. And then a transformed WHO. So he has a Director General Tedros has several vision statements, which I'm just going to summarize here for you. He is wanting a world in which everyone can live healthy, productive lives. He believes that the global commitment to sustainable development, which is directly from the Sustainable Development Goals offers a unique opportunity and to address the social, economic, and political determinants of health. Achieving this will require a strong and effective WHO that is able to meet emerging challenges and achieve the health objectives of the Sustainable Development Goals. So he is essentially acknowledging that some of the management of the WHO in the past was perhaps not as efficient, not as transparent, not as accountable with the funding that they had been given. So it is very much one of his objectives to ensure that there is a strong transparency in the WHO of the 21st century. So his second vision is putting people first. He wants to make sure that everyone, whether they be migrant, displaced, disabled, living in rural or urban or low income, anyone who's vulnerable, he wants to engage with them and learn from them, which is a nice change to see in international organizations, which have sometimes in the past had a we're coming in and taking over and going to do it our way instead of trying to listen and learn from the people of the community. So his second one is putting health at the center, or third one, excuse me, is putting health at the center of the global agenda. So he's wanting to implement international health regulations and emerging threats, which I do talk about later, but like the antimicrobial resistance or drug-resistant bacteria, climate change, and just trying to figure out how to really stress that these things are a central component of the world's security and can affect the economic and development agendas of countries. So it's all about trying to drive the progress towards the Sustainable Development Goals. Additionally, he wants to engage countries and strengthen partnerships. So he is wanting to champion country ownership so that they are involved as full and equal partners to guide and to assist with making the decisions that will affect the health of their country's population. So it's not just this is our opinion, but it's we're working hand in hand with the communities that need our assistance. You know, he's very different, and so he's very focused on making it a community organization within the countries of the member states. So when looking at the reports and statistics that the WHO presents, you can look at the Global Health Observatory, and they are the ones who produce the majority of reports. It's essentially the WHO's gateway for health-related statistics. And this is just how they monitor their progress towards the Sustainable Development Goals. So the GHO issues analytical reports for monitoring. And what they tend to monitor is trends for priority health issues, annual World Health Statistics, tracking universal health coverage, which is the first of its kind global monitoring report. The current state of inequality regarding reproductive, maternal, newborn, and child health throughout their member states, women and women's health, global health risks, and then a very large variety of statistic reports, which I will not bore you with reading, but you can look at there. And they track all of these and release them either annually, biannually, or quarterly. So in looking at the history and everything that the WHO has done in the past, it's important to look at how the WHO is relevant in the 21st century. They began with the mission to have better health for everyone, everywhere. And in the 21st century, as we are attempting to move towards universal health coverage in the United States, this is interesting in many ways. So the WHO has served in a direct capacity regarding polio eradication. Just recently, it was announced that 2 of the 3 wild polio virus strains have been eliminated worldwide, following the conclusion by a group of experts that WPV3, which is type 3 of the disease, has been eradicated completely. And this is very, very impressive. If you have ever read history or read the history on polio, you can see that while in America it may seem that it's been eradicated, in other parts of the world there is still a significant impact on children, and it has not. So the fact that they have eradicated type 3 is very impressive. They are one of the main supporters behind the Ebola vaccine, which is currently, and you can go out and find many, many news articles on this, they're significantly closer to authorizing with government authority the RVSV-ZEB-OVGP vaccine, which has been shown in test cases to reduce the effects of Ebola and in some cases reverse it. And this is something that after the Ebola outbreak in West Africa really became a priority for the WHO, and still remains a priority as the outbreak has slowed, but it is still ongoing in Africa, especially in the Congo. And then finally, this is more recent, but they are very, very dedicated to antibiotic resistance awareness. The WHO is dedicated to increasing global awareness regarding the dangers of overprescribing antibiotics. So as that increases with time, this is becoming a very urgent health crisis felt by many, many doctors and medical experts around the world, that we are looking at some very serious drug-resistant bacteria in the future that could have a significant impact, not just in developing countries, but also in Western civilization, such as the United States, Canada, basically the developed countries, for lack of a better way of putting it. So in conclusion, despite the criticisms which have plagued the WHO over the last several years, this can be seen in particular with the speed of response shown to the Ebola crisis in West Africa and the response time for the Zika outbreak. The Ebola crisis, it took them much longer to respond to the crisis versus the Zika outbreak, which was instantaneous, or much faster rather. Many people argue it's because they were trying to learn from their mistakes with Ebola. It still remains one of the few international organizations which is capable of launching a global response for an urgent health crisis. And considering that the next great crisis that could face the entire world, as I said before, could be drug-resistant bacteria outbreaks, they remain extremely relevant. The WHO remains extremely relevant for the 21st century. So thank you so much, and I hope you enjoyed the presentation.